I'm delighted to invite our next speakers to come onto stage. Speaking on the topic of labor, citizenship, and health. Dr. Meredith Natta is a researcher at UC Merced, whose work focuses on how immigrant patients and their healthcare providers in the U.S. balance risks against the threat of detention and balance health risks against the threat of detention and deportation. She's joined by Alejo, Executive Director of Trabajadores Unidos Workers United, TUWU is their acronym. She's a community leader who organizes workers to fight for living wages and fundamental health benefits for non-citizens. And Mariana Cabrera, an outreach worker from Merced County whose work with her local community has been a model for successful participatory research. And we have an interpreter on stage as well. Reina Rodriguez from, remind me of the name of your organization? Linguistica, which is based in the Central Valley and which we learned of during a meeting that we had last fall or last summer. And we're delighted to have them here. I think this may be the first conference at UCSF where we had simultaneous translation available. So your feedback on how it's going will be very valuable to us.
Okay. So, all right, we'll get started. Y como dijo, si necesita servicio de interpretación, ahí está la mesa. Okay, just want to make sure. All right. Well, thank you all. Thank you so much for attending. Thank you to UCSF for hosting this important event, and thank you all for welcoming us today. We're going to be talking about the intersections of labor, citizenship, and health, and this actually dovetails in many ways quite well with the panel that we just saw. So some of these themes may be familiar, but we will hopefully put a little bit of a different angle or different lens on them through the variety of perspectives that we've gathered today. Okay, so I guess I'm advancing the slides. Oops, that's the slides. All right, so just to give you an overview of what we'll be covering today, I am Meredith Natta. I'm an assistant professor of sociology at the University of California, Merced. I was actually trained here at UCSF. I did my PhD here in the sociology program. And I'll be talking about the structural challenges that link labor, citizenship, and health. Then we're going to zoom in and get more a sort of on-the-ground level perspective from a promotora who is doing outreach work in Central Valley communities. So we'll, at that point, I'll hand the mic to Mariana Cabrera. And you can see the bios in your folder. So if you're curious about who we are, please take a look. And then we will zoom back out at the end with the policy interventions from the labor perspective. And at that point, Jennifer Alejo from TUWU will be presenting her perspective. And then we'll bring it all back together and try to tie a little bit of a bow on the telescoping perspectives among labor, citizenship, and health that we introduced today. And of course, we'll do the Q&A. Okay. So as I mentioned, I'll be talking about the social citizenship exclusions that are related to the ideas of citizenship, how we think about this, how it's very much racialized, and what the implications of this are for the safety net, right? And not just the healthcare safety net, which is maybe what many of you focus on if you're related to UCSF, but also what that means for health and well-being beyond the exam room, beyond the clinic, in everyday life. Mariana will be talking about her expertise as a promotora, about what it's been like to collaborate with researchers and public officials. Alejo will be talking about the perspective of labor organizing and the links between worker rights and health, as well as her experience working with the Safety Net for All campaign. And then I'll tie it all back together and we'll have some concluding remarks in the Q&A. Okay, so when you see the word citizenship in the title of the talk, you probably think about, immigration and immigrant politics, immigrant rights. And of course, this is a volatile topic, right? And we're in another election year, so there may be many things that come to mind, discourses, rhetoric, and much of which is exclusionary, much of which is potentially xenophobic, racist, et cetera. And that is something that we see kind of rise and fall sometimes with particular election years or particular administrations. But what I want to do today is actually situate this in a longer perspective, in a historical perspective, and connect it to the political economy. So again, I'm a sociologist, but I am a medical sociologist, so I know you probably weren't thinking you were going to get a social theory lesson today, but just hang in there. So I want to situate these current moments of immigrant exclusions, of citizenship-based exclusions from health and well-being within a broader context of the social construction. What do we mean by citizenship? And what does that mean then for material conditions? So in some of the literature, I would say since around 2010, 2011, there's been increasing attention to the idea that citizenship status or legal status could be considered a social determinant of health. And we've already talked about one area of a social determinant of health earlier today, focusing specifically on housing, which was great. We were all present for that. But I want to think about really zeroing in on this idea of what is citizenship and what does that mean when it comes to people's material circumstances and their ability to have healthy lives and be secure. Part of what we're talking about today is the connection between citizenship status and work authorization, right? That's a big piece of it. Like legal status and the ability to work with authorization is tied to a number of protections or lack thereof. So of course we could think about exploitative labor conditions, but also that many of us get our health insurance through our employer, right? So if you're not able to work within a system that has an employee-based healthcare system, where in the safety net or where in the sort of state insurance programs might you fall? Or do you fall outside of those? So alongside the actually at work, working conditions, which we'll talk about, there's also the potential for exploitation that comes when citizenship and work are so closely tied together. And again, this relates to a number of social benefits eligibility categories. For those of you, I know some of you work at safety net healthcare centers and you have eligibility workers, or you may be an eligibility worker. I was in the nonprofit sector here in San Francisco and San Mateo before I did my PhD. But we think about healthcare access, right? Is it Medi-Cal eligibility? Is it your county safety net program? What about sick leave, right? Maybe there is actually a functioning healthcare. Thank you. Maybe there is a mechanism whereby you are eligible for care, but you can't actually access it, right? So that is another place where we want to really zero in on the connections between work, worker rights, and health. And then disability, unemployment insurance. Are these available depending on where you fall within this construction of citizenship? And also we think about housing support, nutrition support, whether that's CalFresh, whether that's SNAP, the food stamps programs. Again, citizenship status may not just be an individual category, and it's not static. It changes over time. It's a process, and it involves individuals, families, communities. So when we talk about citizenship status, I really want to complicate it, and I want to connect it to the working conditions and the rights that all play into whether someone can have optimal health. And I said that this was going to be sociological, and so I want to ground everything that we're talking about today within the context of racial capitalism. This is a term that I am not introducing. I did not invent this phrase. It's associated with, apartheid activism, and Cedric Robinson wrote about this in the 80s. But a lot of folks have taken up this concept of racial capitalism to understand the intersection between the policies we see today that criminalize immigrants, that criminalize people of color, and how they are used to exclude folks from the social welfare opportunities. And this leads to, at the intersection of these two areas, injury, illness, and in the case of folks with maybe an unauthorized status, deportation or removal. And racial capitalism, it is a system of white supremacy that supports a particular type of political economy. And again, I'm getting high level here, but what I really mean is that these anti-immigrant politics are part of a broader strategy of including folks in the economy, right, into systems of production and consumption, while excluding them from a lot of the opportunities for full social belonging and well-being. And when I write about this, when I write about it in academic papers or in my book, it's this space where economic inclusion and social exclusion overlap that creates injury and a sense of disposability. And I want to highlight that because we talk about essential workers, we talk about the frontline workers who are so fundamental to the economy, right, that we even have a special category in the pandemic to refer to them. But at the same time, in the way that policies are crafted, in the way that the worker rights are infringed upon, many are being called essential but treated as disposable. And that's what I want to focus on, in the talk today. Okay, so we want to rethink citizenship as we give an overview and situate the perspectives that the other speakers will share today. And so we can think about it in a few different aspects. When we say citizenship, we often think about it as political, right? That there is a political category. You are either a citizen of a nation or you are not. But in reality, there's a whole continuum, right? And it can be a process and you can move along it in different ways. So you may have documents from another country that are not valid. When you cross a border, you may not have a visa, or you may enter with a visa. There may be a temporary status. There may be a process of naturalization or residence, or you may be born in a place and have citizenship because of that. There could be a whole range. And again, people could move along that. Multiple members of the same family could be in different positions. That's political citizenship, right? What is your nationality? But that's not what we're talking about today. We're talking about the actual material reality that citizenship corresponds to. So it can be political, it can be on paper, but it can also be social. How integrated are you into the society that you live in, right? Are you able to vote? Are you able to participate in protests? Are you able to access the safety net? Are you able to, participate in city council meetings or have some kind of civic membership that may be different from your political classification? And then the symbolic aspect is, what do we call a good citizen, right? And there's all kinds of morality that plays around that. It's very much racialized, but it gives us this discourse of deservingness that we then attach to the social benefits, right? And so those are the pieces I want us to keep in mind as we talk about citizenship and work and health. And then finally, I also want us to think about, as we're here in San Francisco today, but we're coming, some of us from the Central Valley, that it can be very place-based in ways that are different than national politics. The challenge is that citizenship is a federal category, right? The political category corresponds to the laws that are made at the federal level, and immigration policies are done at the federal level. But immigrant integration policies and how citizenship actually plays out in a community can be very different at the local level, right? So there could be very exclusionary policies, for example, in Medicaid administration, but Medi-Cal may have different eligibility criteria, and so it does. Especially with the expansion that's happening this year, right? We have the ability to create more or less inclusive policies at the local level, and this has huge ramifications for the health opportunities and the well-being opportunities for non-citizens and their families. And, to give the sort of historical background, and this has been mentioned today, right? And why I wanted to situate this within the framework of racial capitalism is because this is not new. This did not come about in 2016 or 2017. This is something that we've seen since before the United States was the United States, right? The idea of who will become a citizen of this nation that is being built, it was a white supremacist project from sort of the beginning. And so I point out what's relevant for us today is the Immigration Act of 1882, Again, you probably didn't expect that I'd be talking about policies from the 1800s. But if any of you are working with clients or patients who have mentioned public charge, that is first mentioned in 1882. And it's not a coincidence that this is the same year that the Chinese Exclusion Act is passed, right? The racializing project of who is deserving of being a full citizen of this country and a full social member is articulated in the law at the federal level even back in the 1800s. And we're still fighting over it today. We're still trying to figure out what is public charge. There's been a lot of confusion. I sort of situate it here on the map, but in between, right, the 1882 and today, many laws have been passed that chip away at people's ability to be fully socially included, depending on how they get classified in terms of citizenship and how that's racialized. So we see in the 1930s, for example, exclusion of agricultural workers and domestic workers from some of these benefits that are being passed through the New Deal. That is not an accident, it's part of the same project, right? Who are those workers and how do they relate to the idea of an ideal citizen in the United States? Then we have Social Security and unemployment exclusions that come about in the 1970s. And then in 1996, that's a very major year for immigration and welfare reform, right? That's, major laws are passed then that exclude many classes of non-citizens from social welfare and health benefits. Then we have in 1999, the federal specification of public charge, and I keep mentioning public charge because it's a kind of key example that we can all think about today in terms of these exclusionary policies. It gets written down into sort of like it gets written down in detail in 1999, and then the Affordable Care Act happens in 2010, and that it reinforces and remains in place some of these exclusions that happened in the 1990s. It reinforces them. So we see a brightening of the boundaries between those who have US citizenship and legal authorization and work authorization and those who do not. And then public charge was expanded in 2019. Those expansions were walked back in 2021, but now we have a mess of confusion. So a lot of folks who are on the ground, working in communities, working in healthcare safety net contexts, are contending with a lot of confusion, fear, and anxiety, which are very much a deliberate sort of product of these politics. Okay, so you don't have to read the fine text here, but I just want to say, if you're curious, you can look at the public charge rule. You can read it yourself. It was, as I mentioned, altered in 2019 under the Trump administration, and then it was altered again under the Biden administration to try to clarify some of the confusion. But what we see in the research that the Community and Labor Center has done, and I'll mention a little bit more about that in a moment, what we see is there's still residual confusion, that we are constantly being faced against the ghost of public charge, and that this is going to endure, and we need to think about ways to push back against it. So I mentioned the Community and Labor Center, and I am speaking on behalf of the Community and Labor Center today at UC Merced, and the Community and Labor Center has a number of studies that showcase these intersections between labor, citizenship, also climate, public health disasters, that are based at the CLC at UC Merced in the Central Valley, but also resonate across the state. And I've got a couple of QR codes if you want to look at these briefs, but I'll close with a QR code that has a list of all the publications of the Community and Labor Center. But they're focused on doing community-engaged research that is building capacity and power in the Central Valley and beyond, and really focusing on these issues of labor and putting them at the center, rather than thinking of them as incidental and thinking of it maybe as a satellite issue that we could think about in relation to health, but putting that at the center and then thinking about how all these other social realities correspond to that reality. So I've done a couple of studies with the Community and Labor Center and I've linked them here, but one of them looked at the role of community outreach workers who were responding to COVID-19 in real time as both members of the communities that were most impacted and experts on how to connect people with resources. So we've got a study you can read, and we'll hear from Mariana's perspective in just a moment about what that looks like on the ground. And then we also did a kind of zoomed in piece that looked specifically at public charge, how these community outreach workers were contending with public charge, trying to get people information, trying to counteract misinformation. And we place the community outreach worker or the promotora or the promotor at the center of this ecosystem of a variety of institutions and agencies, right? So we've got the local public institutions and agencies, the federal government, state agencies, faith-based organizations, community organizations, healthcare institutions, but also labor unions and worker rights organizations, and universities and law schools. And so we've got the community outreach worker at the center of this whole ecosystem, connecting all of these pieces on behalf of impacted communities. And I wasn't a member of the study team that looked at the flood recovery after the Planada flood last year. If you're not aware, these are some of the images that were circulating in the media after this kind of catastrophic flooding that happened last spring in our region. And Mariana actually was present for the recovery and was part of this recovery team, and she'll talk a little bit more about that. But the UC Merced Community and Labor Center did a community-engaged study that looked at the disaster response and was very much answering some of the questions that you in the audience posed about, well, how do you resonate with policymakers and actually make change and do it in real time when it is most needed by communities? So I've linked with the QR code, if you're interested in that, the study that they did, the report that they came out with, and we'll hear more from Mariana about the details of that on the ground. But I wanted to bring that to your attention. And now I want to hand the mic over literally to Mariana Cabrera, who will be talking about her experience working with researchers, community, and policymakers in the aftermath of the Planada flooding.
Gracias por invitarme a participar en este evento tan importante. Es un honor para mí estar el día de hoy. Yo voy a hablarles a ustedes acerca de lo que hace una promotora de salud en la comunidad y cómo viví mi experiencia en la comunidad de Planada. Mi nombre es Mariana Cabrera, yo vivo en Delhi, es una comunidad rural no incorporada del condado de Merced. Desde el 2016 decidí comenzar a involucrarme más en mi comunidad, en diferentes proyectos, y también comencé a trabajar como promotora de salud. Un trabajo que disfruto hacer y en el cual he tenido diferentes tipos de experiencia con la comunidad. El trabajo de promotora comunitaria es muy importante. Nosotras nos enfocamos en caminar por las comunidades y hablar con todas las personas para poder saber acerca de sus necesidades y así poder traer a ellos los recursos necesarios. Dentro de nuestro trabajo como promotora, nosotros nos educamos también. Tomamos cursos de diversos temas, entre ellos de la salud, para poder llevar información correcta y contestar a cada una de las dudas que a algunas personas les pueden surgir después de una visita al doctor, por ejemplo. Somos esas personas que les recuerdan a sus pacientes por qué deben seguir las indicaciones del doctor. Por ejemplo, durante la pandemia estuvimos ayudando bastante con información, recursos que se ofrecían por parte del condado y del estado. Teníamos clínicas de vacunación que organizamos y había bastante asistencia. Durante este tiempo aprendimos bastante también nosotras. Cada nueva información que se daba a conocer, nosotras la teníamos y veíamos la manera de cómo compartirla con las personas. En ese tiempo pude mirar en las personas su miedo y duda ante tal situación y no creí volver a verlo hasta que escuché un día la noticia de Planada y todo lo que había sucedido, cómo el agua había inundado a toda la comunidad y lo afectados que se encontraban sus habitantes. Se nos dijo en el trabajo que debíamos ir a ayudar a las personas con información y recursos. Planada es una comunidad muy parecida a la que yo vivo. Es pequeña y la mayoría de los residentes son trabajadores agrícolas. Muchos de ellos son inmigrantes indocumentados y por lo menos el 80% de sus habitantes son latinos y su primer idioma es el español. Al llegar en ese momento, nos dimos cuenta de lo afectada que estaba la comunidad de Planada y la falta de información que había entre sus habitantes. Así que comencé con mi trabajo, caminar y tocar puerta por puerta para saber cómo estaban las personas y escuchar sus necesidades de ese momento. En mi caminar, miraba cómo estaban las banquetas llenas de muebles y electrodomésticos dañados por el agua, ya que habían sacado de las casas. Encontramos casas vacías, sus habitantes habían sido reubicados mientras sus casas eran reparadas. Nos tocó ir a buscarlos, se nos dijo por las personas encargadas o por vecinos dónde encontrarlos. Escuchamos muchísimas historias de cómo habían vivido lo sucedido, y hubo algunas que se me quedaron muy marcadas. La primera es la de una joven que estaba postrada en cama y que necesitaba estar conectada a ciertas máquinas y al oxígeno para poder vivir. Y ese día sus papás y personas ya un poco mayores no creían lo que sus ojos veían y por consiguiente no sabían qué hacer. El agua se había metido a su casa y la luz ya había sido cortada en todo el pueblo. Ellos conectaron a su hija a un viejo generador de luz que tenían y llamaron al 911. La ambulancia tardó en llegar porque ya no se podía pasar tan fácil. Al momento de que la mamá me platica su historia, aún sentía la angustia y sus ojos se llenaban de lágrimas. Su hija fue trasladada al hospital donde permaneció hasta que pudieron regresar a su casa semanas después. Otra historia que recuerdo es la de una pareja ya de personas de la tercera edad. La esposa no caminaba, estaba en silla de ruedas y el señor contaba cómo los bomberos llegaron hasta su casa en lancha a rescatarlos después de que llamaron al 911. También porque no había manera de salir por sus propios medios. Una vez que el canal colapsa, el agua se lleva todo a su paso y se mete por doquier. Cada persona en Planada tiene una historia y algunas personas nos contaban el miedo que sus hijos podían sentir al irse a dormir escuchando que afuera estaba lloviendo y pensando si otra vez volvería a pasar una tragedia, ya que después de la inundación el clima pronosticaba más lluvia. Las personas en la calle nos detenían para preguntarnos información y aprovechaban para platicar con nosotros de lo sucedido. Ellas querían ser escuchadas, querían sentir que eran importantes y al saber que hablábamos el mismo idioma les daba más confianza. Después de darme cuenta que algunas personas no tenían información de recursos, fui a donde se encontraba instalada FEMA para poder obtener la información de las personas que ellas necesitaban. Y en el mismo sitio donde se encontraba FEMA estaba también el consulado mexicano, que tenían consejería emocional y caridades católicas también estaban. Busqué los bancos de comida cercanos y el horario del centro comunitario, donde en ese momento se distribuían despensas y comida preparada, entre otras donaciones. Obtuve toda la información posible de diferentes recursos para poder ayudarlos. Sí había recursos, sí estaban ahí, pero las personas no se acercaban a ellos por diferentes motivos. Algunos por miedo, por su estatus legal en el país, otros por el idioma y otros más porque realmente no saben que existen los recursos. Durante un desastre público, el gobierno quiere apoyar, pero a veces no sabe cómo colaborar eficazmente. Podría decirse que no saben cómo usar todos los recursos que existen juntos a la vez. En el caso de Planada, que no es un área de inundación y donde incluso los habitantes no tienen en su seguro de casa la póliza que incluye inundaciones, no existía un plan para esto. Ellos no sabían qué hacer primero. Y es ahí donde las promotoras tuvimos nuestro rol necesario porque ayudamos llevando la información de albergues en donde estaba localizado FEMA, en cada lugar de toda la información que las autoridades daban, porque estas personas estaban incomunicadas, estaban regadas por donde quiera. Algunos habían optado por irse con familiares o a hoteles porque no sabían cómo era un albergue y cómo funcionaba. Y al no existir la organización correcta, Nosotros como promotoras éramos esa fuente de comunicación porque también les llevábamos a las autoridades las necesidades que veíamos de las personas afectadas. Al darse cuenta las autoridades de lo que nosotras estábamos haciendo, nos invitaban a sus reuniones y nos dejaban saber toda la información. Se creó un equipo de trabajo con ellos, éramos su apoyo para dar la información. Ellos se dieron cuenta de lo importante que era tenernos, porque mientras ellos se encontraban trabajando para hacer el plan, nosotras salíamos a compartir información y recursos hasta donde las personas se encontraban. Les pedíamos a las personas que asistieran a las juntas que las autoridades estaban realizando y ellos acudían. Después de esta situación, las promotoras fuimos vistas de diferente manera y esperamos que así siga siendo, que se nos dé el reconocimiento a todo nuestro trabajo y que las autoridades sepan que aquí estamos para ayudarles también y que podemos ser equipo. Los oficiales del Estado, los condados y las ciudades podrían crear un mejor sistema para capacitarnos y nosotros hacer todavía un mejor trabajo de alcance y educación y crear un mejor sistema. Desafortunadamente, no todos los habitantes de Planada pudieron obtener ayuda de FEMA por el tipo de requisitos que ellos piden. Los líderes comunitarios pidieron a los funcionarios electos $11 millones e inicialmente los funcionarios rechazaron esa solicitud. Después de algunos meses regresamos a la comunidad de Planada y comenzamos a platicar con las personas nuevamente y a pedirles que nos contestaran preguntas de encuestas que eran necesarias para evaluar sus necesidades específicas en la comunidad. Ellos confiaron en nosotros para contestar nuestra encuesta y hablar abiertamente de sus necesidades, ya que nos conocían y conocían el trabajo que habíamos hecho, y siempre nos miraron iguales a ellos y nos sentían como de su comunidad. A través de nuestros esfuerzos colectivos que incluyen nuestras interacciones con la comunidad, pudimos traer la ayuda económica para Planada y sus habitantes. No solo 11 millones, sino 20 millones, y también fue para la comunidad de Pájaro. Nuestro trabajo aún continúa allí en Planada, porque estamos apoyando con la repartición de las aplicaciones a los habitantes para que puedan tener acceso a este dinero. Nosotros estamos ayudando a los funcionarios del condado a guiar este proceso. Nosotros también tenemos las habilidades necesarias para guiar este tipo de actividades en las comunidades afectadas. Esta es mi experiencia en Planada y cómo es parte de mi trabajo como promotora de salud, algo que me llena de orgullo. Gracias por escucharme.
Thank you for inviting me to participate in this very important event. It is an honor for me to be here with you. I am going to talk to you about what we as a health promoter do in the community and how I lived my experience in the community of Planada. My name is Mariana Cabrera. I live in Delhi, which is a local rural community, not incorporated in Merced County. Since 2016, I decided to get better involved in my community and these projects, and also to be able to support as a promotora. It is a job that I love to do, and where I have had the opportunity to have many of these great experiences with the community. My job as a promotora, a community promoter, is very important. We focus on going out into the communities and talking to all the people so that they can know about the needs that they are addressing. And that way we are able to bring out the resources that they need. Within our work as a promotora, we do educate ourselves as well. We take courses on different topics, amongst them health, so that we can take out information, correct information to the community and be able to answer any doubts that the people might have after a doctor's visit, for example. We are those people that remind patients why they need to follow doctor indications. For example, during the pandemic, we were helping a lot with information, with resources that were needed or being offered from the state or the county. We had vaccination clinics that we would organize to make, and there was lots of participation. During this time, we also learned a lot ourselves Every new information that would come out, we would go out and reach out to that information and then see how we would be able to share with community. During that time, I was also able to see the doubts and the fear in the community through this situation, and I was able to relive it again when I heard the news about Planada and everything that they had experienced, how water had inundated the community and had affected the local community members. We were told at our job site that we needed to go out and help people with information and resources. Planada is a community that is very similar to the community that I live in. It's small, and a lot of the residents are agricultural workers. Many of them are undocumented immigrants, and at least 80% of the community members are Latinos, and their main language is Spanish. While helping during this time, we noticed how effective the community was in Planada and the lack of information that the community was accessing. So I started with my work, going and knocking door to door to make sure that I knew what the people were experiencing, listened to their needs during that time. During my walks, I noticed how the sidewalks were filled with furniture and home electronics because they had all been damaged due to the flooding. We found the houses empty. All of the locals had been relocated due to all of the hazard their homes had experienced. We had to go knocking door to door to find out where they were now being housed at. We found out many stories on what had happened during this time frame. There were many stories that stayed very ingrained in my mind. First comes to mind a young lady that was bedridden, and she had to be connected to many machines and oxygen just to live. And that day, her parents, who are already elder, couldn't believe their eyes, and consequently, they didn't know what to do. Water had seeped into their home, and they had already lost electricity. So what they did was connect their daughter to an old generator that they had, and they called 911. The ambulance took a long time to get there because transiting through the community was very difficult. While I was talking to them, I could see the anguish and the tears roll down their face, and it was very difficult for them to be there. So she had to be at the hospital until they were able to be rehomed again. And I remember another person, they couldn't walk. The husband was in a wheelchair, and they were recalling how they were rescued on a boat because same thing, they weren't able to escape on their own means. Once the canal collapsed, the water took everything in their way and seeped into every corner. Every family in Planada has a story, and some people would let us know the fear that their children could feel when they would go outside and see the rain and wonder if another tragedy like that would happen again, because after the rains, it would the weathermen would state that more rain was probably coming. So they were always wondering what would happen. But the community wanted to be heard. They wanted to feel that they were important. And knowing that we spoke the same language gave them more trust. After noticing that some people did not have information to resources, I went to go find the location for FEMA so that I can get the information that the community members needed. And at the same location where FEMA was, the Mexican consulate was also there, where they had mental health wellness counseling, and they also had Catholic Charities there. So during this time frame, yes, they had food pantries and other resources that they were distributing. I tried to access as much information on resources as I had available to me. Yes, there were resources. Yes, they were there. But people would not approach the resources for different reasons. Some because of fear due to their documentation status in the States, others because of the language barrier, and others because they really did not know that these resources existed. During a public crisis, government wants to help, but oftentimes they don't know how to provide that support. Oftentimes, Many people don't know how to use these resources at the same time. In Planada's situation, where they were not in a floodplain, many of them don't have flood insurance. So they did not have a plan for this. They didn't know what to do first. And that's where we, the promotoras, the health promoters, had our essential role, because we helped to make sure that we were taking out the information to the centers where they were being rehomed, and to every corner where we were finding the families, because these families were scattered everywhere. They were uncommunicated. Many of them had opted to go live with family members or in hotels because they didn't know how to work with the shelter to be able to be sheltered. When we noticed that they didn't have the right information, we, the promotoras, were that medium of communication, because we would also take over to authorities the information that we were finding out by the affected people. When the authorities saw what we were doing, then they would have us join their meetings, and they would make sure that we were aware by welcoming us, and we were their support system to be able to get the information out to the community. So it was really important to have these relationships, because while they were working on a plan, we would go out and share the resource and information to the people where they were found. We would ask people who would participate in the meetings to go to the meetings, because the local authorities were coming, and they would go to the meetings. After this, the promotoras have been seen through different eyes, and we hope that that continues. We hope that recognition is given to our work, and that authorities know that we are here to help them, and that we can be a team. State officials, local officials, and our community officials can create a system so that we can be given the capacity building and the training so that we can create an even more fortified system. Unfortunately, not all the residents of Planada were able to get support from FEMA due to the requirements that they asked for. The community leaders asked local officials $11 million. Initially, the local officials rejected that application. After a few months, we came back to the community of Planada, and we started talking to the people once again and asking them to answer questions and do surveys that we felt were needed to be able to evaluate their individual needs in the community. They trusted us to answer the questions on the survey and to speak openly about their needs. Since they knew us and they knew the type of work that we had been doing, and they always saw us as equals, and they felt us as part of their community. Through our collective efforts, which include our interactions with the community, we were able to bring the economic support to Planada and its community members. Not only 11 million, but 20 million. And it was also for the community of Delhi. Our work still continues in Planada. What we are supporting through this application process, we're supporting all of the locals so that they can access this funding. We are also helping local officials guide this process. We also have the abilities needed to be able to guide these type of activities in the affected communities. This is my experience in Planada and how it is part of my work as a health promoter, something that fills me with great pride. Thank you for listening to me.
Well, thank you so much, Mariana. I'm going to pass it now that we've gone to sort of the work on the ground and how that connects to legislative impact and, changing real material circumstances through the connections in the community. We've identified some issues and some challenges and some exclusions, but now we want to say, okay, what are we doing about it, right? How can workers fight for their rights and fight for a more expansive and inclusive safety net? So I want to pass it over now to Alejo from TUBU to talk about the worker rights and health from a labor organizing perspective.
Hi, everyone. I usually don't drink coffee, and I drank black tea today, and I'm going to try to move slow for the interpretation, so just a heads up. Hi, everyone. I'm Alejo. I'm the Executive Director at Trabajadores Unidos, Workers United. You'll probably hear me say TUBU for short. TUBU was founded in 2002. It was formerly known as Young Workers United, and it was funded during a time that there was a lot of young workers in San Francisco, a lot of them in the service industry, and a lot of labor violations. Maybe there's some folks here from the Bay, maybe there's some folks that have been here a long time, and we've seen the community change. It's changed a lot. So in 2020, we changed our name from Young Workers United to Trabajadores Unidos Workers United to better reflect our base, to better reflect our membership. Our membership wasn't that young anymore, right? It wasn't just folks who were documented. It changed a lot to undocumented immigrant workers. A little bit about TUWU. TUWU is a regional Bay Area immigrant worker center. We stand in the intersection of economic justice and immigrant rights inclusion. We believe in upholding the power of working class immigrant workers through building working class consciousness and growing the leadership of low-wage immigrant workers. We seek to abolish workplace exploitation through workplace organizing, political education, and direct action to really be able to shift power to the hands of the working class. Our membership is mainly composed of south of the border immigrant workers. Majority of them in San Francisco are indigenous Yucateco folks. And in the East Bay, they're mostly indigenous Mam from Guatemala. In the past 2 years, we have been organizing with newly arrived Nepalese immigrant workers. And definitely a lot of labor violations, right? Nepalese is not a language we've taken, but it's one that we've invested in interpretation and translation because it's important to organize those who are very vulnerable to labor exploitation, especially because of their immigration status. TUWU, we're part of the Safety Net for All Coalition. It's a coalition that's composed of over 150 organizations throughout California, and we're all really united for the fight to have an inclusive safety net for all workers. This year, in the past 2 years, really, we've been fighting for unemployment benefits for immigrant workers who are currently excluded from unemployment insurance. This would provide a temporary wage replacement for undocumented workers who cannot work. A little bit about our day-to-day work at TUWU. We talk to workers every day. We're doing outreach. You might see folks out on the street, on BART. So in a month, we talk to about 500 workers. And every time, without a miss, the one issue that is the same across the Bay, across any industry, is access to paid sick leave. So maybe some of you all know, but there's actually labor laws that protect folks from taking paid sick leave. Yet a lot of our base, a lot of our members don't feel that they have access to it because of their immigration status. I'll share a little bit about like San Francisco paid sick leave in case y'all don't know. But San Francisco has a paid sick leave ordinance. It requires employers to provide paid sick leave to all employees, whether you're temporary or part-time employee. If you're working 1 hour, for every employees earn 1 hour of paid sick leave for every 30 hours worked. There's very similar ordinances like in different cities, regions. We have one statewide, but I just wanted to share a little bit of what we have in San Francisco. And also to note, San Francisco was actually one of the first cities nationwide to pass paid sick leave, right? We definitely set the tone in the city. And like I mentioned earlier, many workers are scared of asking for paid sick leave. We're talking about a community that has no economic security. No economic security whatsoever, are taking days off without pay. And some workers don't even take any time off when they're sick because there's fear of retaliation. Retaliation looks very differently. It has so many different forms. And one of the ways that it shows up the most is workers taking a sick day, not even a paid sick day, a sick day. They come back to work the next day, and there's no job for them anymore. I want to share a story of one of our members, Santos Vladimir. Santos is a janitor. He's in his 50s. Older man, has been working at the same building for about 6 years. Shows up on time, leaves on time. In 2023, last year, Santos was diagnosed with a chronic illness, which required him to visit the doctor, probably for the first time, twice a month. Twice a month, he had to visit a doctor in 2023. And in December, the employer was like, look, Santos, you are taking too much sick time. I am going to cut your hours in 2024. Instead of working 5 days, now you're working 3 days. This is the type of retaliation that immigrant workers are subjected to, right? This is a person who has been loyal to their job for the past 6 years. The moment that he got sick, the boss was not going to be supportive. Thankfully, Santos found our organization, found TUWU, and we decided we do consultations and we organize. That's the role that we take. That's our role in our community. During this time, we were able to do a few things. The first thing was just a little taking a step back. In order for any worker, in order for any community member, folks here, to want to make a change in the workplace, you have to confront your boss. And that's really scary. That's really scary for folks who are documented. And even more scary for folks who are undocumented, right? We're talking about lack of economic security, and this is the job that sustains you and your family and maybe other folks too. We were able to fight with Santos after he said, yes, I will confront my boss and I want to organize. We built majority in his workplace. And Santos confronted his boss about the paid sick leave that wasn't paid in 2023. Through organizing, we were able to get him the back wages of 2023 paid sick leave that were not paid. He was also able to put his employer on notice and let him know, you telling me very clearly and upfront that you're cutting my hours because I'm taking paid sick leave is a form of retaliation and it's illegal. I need to be able to keep my 5 days. During this process of us, meeting Santos, organizing with him during our consultation, we also found out that Santos wasn't getting paid the minimum wage. He didn't know he wasn't getting paid the minimum wage. This is someone who's sick, who needs all the funds that he can get to be able to cover his medical situation. He's not getting paid minimum wage. His 2023 paid sick leave hours were not getting paid. And then suddenly he was hearing that 2024, he can expect a schedule of 3 days instead of 5. We won the first two things, which we're really happy about. And currently, we are working with him to file an official complaint with the city of San Francisco. Like I said earlier, retaliation comes in different forms, and this is just one of them. There's some scenarios where employers direct their employees to their own doctors. And these doctors are on the side of the employer. There have been members who come in and, I'm not a doctor, but when you see someone and you can tell, like, you look sick, like, you shouldn't be working, yet they have this doctor's note from their company, from their job company that say, no, you can go right back to work. In San Francisco, in the Bay Area, you are able to visit other doctors in the Central Valley, right? Like how we're hearing from our compañeras, that might be the only doctor you have access to, right? These are the things that our immigrant communities are facing, workers are facing every day. This is also not just a Bay Area issue, right? This is not just a regional change that we need to do. We're really addressing how we view immigrant workers, what we think of them in the labor sector. So Santos' story is really just one story. There are many members in TUWU with a similar story. Mainly, There's also many immigrant workers across California who are struggling the same way every day. This is why TUBU, this is why we're part of Safety Net for All. This is why we're part of this coalition, because we believe that in a society where immigrant labor is at the center of making our society prosper, we should be able to take care of each other. There was a time, and we talked, it was earlier in the presentation, where the exclusion of unemployment benefits for immigrant communities didn't exist. There was a time where public charge wasn't as messy, as confusing as it is now. So we know that it's possible. We know it's possible to include immigrant workers, and we keep fighting in Safety Net for All to make that a reality. Immigrant workers, immigrant excluded workers across California in our coalition, we meet every week. Every week we meet to plan, to organize how we're going to build collective power, to pressure the governor to make the right choice and include workers in a safety net for all. In 2023, a year where California had a surplus in our state budget. We don't really see that a lot. That happened last year, right? There was a surplus. Our bill didn't pass, right? It didn't pass. We got all the support we needed. It got to the governor's office, and the governor vetoed it. And there was two excuses to why he vetoed it. The first was there's not enough money in the budget. We had a surplus last year, right? The second reason was, well, how would EDD make this work? And I want to go back to the surplus thing. It's never a good time for a budget, unless it was 2023, but that didn't happen, right? So this year, what we're deciding to address in our Safety Net for All coalition, we're fighting. There was also a big mess around EDD during COVID. Maybe some of y'all experienced that or met someone or know about it. But this year, it's this big reconstruction of EDD, re-envisioning of how to make it work for working class people in California. And we are fighting and we're demanding that the budget, that there's $250,000 set aside in the budget to really think through how to include excluded immigrant workers in the EDD process. Part of this fight, we know it's a long fight. Our goal is not to be in a 10-year fight. It's never the goal to be in a 10-year fight. We always want to just, do our efforts, take the people we need to the Capitol, be able to say, talk, lobby for what we think is right and win. But that's not the reality, especially these past years with our current leadership in the Capitol. And the support that we really need from everyone here, I think the support that we can all give is to really engage with community members, really be able to motivate immigrant workers to be part of an organization, really encourage community members to be part of the fight. And for folks here, whenever possible, be able to give public comment. Public comment is really important in the Capitol, to be able to hear from different folks, maybe folks who are not directly impacted, but folks of conscience, right, who understand what's right and what our community needs. So that's our fight for this year, Safety Net for All. Our biggest goal is to win unemployment benefits. We've gotten all the support that we need. It is possible. UC Merced Community Labor Center has led some of the most amazing research that y'all should definitely look into if you're interested in how that looks and how that can be a reality. And we as a coalition really hope that when the time comes, when needed, y'all can show up, public comment, and a really easy way to get engaged is probably Googling Safety Net for All, signing up for the emails, and just keep yourselves updated with how the fight for a safety net that includes immigrant workers, how that's looking. Thank you all.
So in the essence of time, I will just very quickly put a bow on what we've seen today, just reminding everyone to think about citizenship status as a racialized social determinant of health, to think about the safety and exclusions that have been discussed today about why people can maybe not get FEMA assistance, even if they know about it, or why they may not be able to use their sick pay, even if it's guaranteed to them under the law. Cultivating collaborations among community, promotoras, promotores, researchers and policymakers, and building power and sustainable solutions for the future. So I said I would give you the QR code. So as Alejo said, a lot of this work has already been done by the UC Merced Community and Labor Center in innovative ways. You can see a list of publications here from this QR code, and we can address specific questions now in the Q&A. But thank you so much for being here and hearing our words, and hopefully moving forward from here with some of the action items that you've been given.
Thank you. Thank you. Good, the mic's working. What a wonderful presentation. We're so honored to have folks from UC Merced and the communities there to come here and tell us about the amazing work that you're doing. I think we've heard a lot of why academic inquiry is important to understand what's going on. We also heard a lot about how important community action, community-based grassroots action by people with lived experience and trust is important, and how that's important for you're all doing your own research in a way. Your own research and action. And I think what I would love to hear you speak towards a little bit is like, how can our academic institutions support and catalyze this work in a better way? Because it seems very much like it is a struggle. And as much as we try here in our ivory tower to support this kind of work, it seems like it's never really enough. And I just would love to hear your perspectives, all three of you on that topic. What can we do? What resources would you like to see UC Merced develop more, or UCSF develop more, so that we can help you be successful in your work?
¿Quién quiere empezar? Who wants to start? If there are things that come to mind that you've thought of that might make things easier or harder, you can go ahead and start, and then I can chime in from being within an academic institution.
And I also, you may have a lot of things to say, but I also want to leave a few minutes for other people to ask their questions, because I'm sure there are many.
Bueno, nosotros lo que nos gustaría es que se nos reconociera el trabajo que hacemos, que las autoridades correspondientes nos apoyaran, y desde allí se comienza, desde que se nos reconoce como promotoras, que se reconozca el trabajo que nosotros estamos haciendo y que se nos apoye en ello, en el trabajo.
Well, what we would like is that we are recognized, that the work that we are doing is recognized, that the corresponding local authorities would support us and start from there. From the moment that we are recognized as promotoras, as community health workers, through the work that we are doing, to get that support that we are doing through our work.
Yeah, I think there's two things that come up for me. I think when it comes to research, one of the best experience I've had has been working with UC Merced Community Labor Center. I've seen research be very centered on folks on the ground. And when I talk about folks on the ground, I'm not just talking about myself. I'm really talking about the experiences of impacted communities. I think doing more of that is really important. So that's the first thing I can think around research. And the second thing is what I just mentioned. It's really, there's just so much that can be done. I think of our membership who are folks who have two jobs. They have a restaurant job in the morning, a janitorial job at night, and when it's lobby day, they're taking the day off. Our organization doesn't have the funds to reimburse people for taking the day off. But they do it because it's important. This is going to impact them directly. I think signing up for our emails, taking a day off of work or school, just one day to come out and do public comment, especially in a different perspective, not part of an organization, but really from your own experience, is something that's really important. Letters of support. I wish there was a lot more things I can talk about on the ground, but because this is a policy fight, we also have to engage with the tools and the tactics that Sacramento needs, right? And a lot of that can be done from home. Could be just setting, putting the public comment on the background. Well, I think close public comment on the phone. But yes, taking a day off and going to Sacramento when we're making call-outs for support. That in itself, it's a lot of support, not only for our efforts, but it really builds community. It really allows impacted community members to know and see that there are other folks who might not have their same lived experience that support them. Because like I mentioned earlier, this is a fight for a really, really long time. It's really easy to get burned out. But when we're surrounded by community, a lot of things feel and are possible. So those are the two things that I would lift up.
And I'm so glad, grateful to both of you for sharing those things. And then, from the perspective within academia and reflecting on the panel this morning, thinking about like a lot of times we as academics have research questions and intellectual curiosity, and we want to move really fast and pursue those questions and use rigorous data collection and analytic methods. But it can be hard when we're going at that pace in a career that is often very much arbitrated on an individual basis to say, okay, well, what if I actually ask, if I wait and see what is the question standing before me from the community. And this is one of the reasons that I also am grateful to be part of the UC Merced Community and Labor Center, is because they create that space to say, well, what is the agenda of this particular community group or organization? What do they need? And as a researcher, I can't say, perhaps, oh yes, I am going to provide this type of answer to this question. But I can say I can ask these types of questions and use these types of methods, and I have this realm of expertise. So in my capacity as a researcher, if the institution allows me the space to do it, which I think can be really challenging. I've been in different institutional settings, and some are a little more, they give you more pushback when they perceive you as being activist-oriented. Fortunately, well, you can all reflect on that within your own institutional positions, et cetera. But when you have an institutional space that allows the space and time that you don't have to always drive the agenda and you don't always have to impose your perspective on others, then I think you can start to achieve some of the work that you can see in these publications. And then also, figuring out what your priorities are as a researcher and how you're going to use the time that you have, which is very limited, and juggling a lot of things. But if it's in your capacity as a researcher, or if it's your capacity as an expert when it is time for public comment, right? And you may be an expert in things that you don't even realize that you're an expert in, right? But just being even a healthcare provider, knowing that there are a variety of social determinants of health, including citizenship status, that means you may be speaking on immigration-related public charge matters. You may be, speaking on the criminal legal system. So many things that you maybe don't feel that you want to stretch yourself in those ways, but you are an expert and you can make those comments even without your institutional sort of assistant professor or professor hat on. So I guess that's all I know.
Yeah, I'm very hopeful that as UC Merced develops its own medical school, that there's a lot of time for opportunities for sort of out-of-the-box thinking about how to not be so narrow in how we define medicine and think about some of these other upstream social determinants of health. Were you going to say something, Raina?
Bring the mic closer. Raise the mic a little.
Oh, I'm sorry. Could you not hear me? Oh, some of you could hear me. Well, are there questions in the audience? Because we do have a few minutes. Who has a microphone? That's the first hand I saw is over here.
Hello? Sí. I'm going to speak in Spanish to the promotora, Diana, and I can translate myself, but
can you introduce
translate
yourself too, please?
I'm sorry? Yes. My name is Rebecca Flores. I am a worker at San Francisco Department of Public Health. I work for the Office of Anti-Racism and Equity in the Population Health Division. Mexicana, Americana, Mexican American, and I work with promotoras quite a bit. Nada más quiero decir que algo clave que es fundamental y importante que las personas deben de saber es la confianza que los promotores le proporcionan a la comunidad, porque el miedo a la migra es real y verdadera. Y los promotores traen una conexión a la gente porque se reconocen en su mismo rastro, ¿verdad? Entonces, eso es algo que es tan importante para conectarte y dar información muy necesitada. Pero mi pregunta es, ¿cómo reconocemos a los promotores en estas instituciones académicas con un certificado para que ustedes puedan subir a otro nivel? Porque su trabajo es tan importante como es el trabajo de un doctor. Están haciendo esa conexión. Mi pregunta para usted, señora, es, ¿tienen promotores en su organización también? Do you have promotores in your organization as well?
We're not a service organization, we're an organizing organization, and our organizers are what some folks are familiar, our rank and file. They come from the base, because you're right, there is more trust from someone that speaks their language, has the same immigrant story, and the same, and they're able to relate to. But we don't call them promotores, where they're rank and file organizers.
And so sorry, just to follow up. So we know that it is important and fundamental for people to have that trust with the promotores. And I think that that's what the health promoters bring to the community, a lot of trust, because the fear of ICE is real. It's a true fear. And promotores, or health workers, bring a connection to the people that they recognize, they have that connection. So that is something that is very important to ensure that you have what's needed to go out and give information. But my question is, how do we recognize the promotores in these institutions, in these academic institutions? How do we recognize you with certification so that you can reach another level? Because your work is just as important as a doctor's work, and we need to make sure that we are recognizing your work. And the other question was whether she has promotoras or health workers in her organization.
Antes que nada, gracias por sus palabras. Gracias de verdad por ver en nosotras el trabajo que hacemos. Yo pertenezco a una organización, somos puras promotoras. Cuando nosotros llegamos a las comunidades, nosotras llevamos nuestras credenciales, nosotros nos identificamos. En la comunidad es fácil. El trabajo que nosotros hacemos, desafortunadamente, las autoridades no tenemos tanto reconocimiento, tantos beneficios. En la organización donde yo trabajo, nosotros trabajamos como si fuéramos nuestras propias jefas, por decir así. A nosotros nos gustaría que el trabajo de nosotros tuviera más beneficios, ¿verdad? Que eso es lo que nos gustaría, que las autoridades comenzaran a ver a nosotros, que tan siquiera nos vieran como que es un empleo en sí, ¿verdad? Que tuviéramos acceso a más beneficios. Eso es lo que a nosotros nos gustaría, y por eso es que estoy aquí, para que ustedes comiencen a saber el trabajo que nosotros hacemos, y que así como en Planada tenemos experiencia en muchas más cosas, ¿verdad? Eso también es algo que las promotoras hacemos. Podemos hablar de diferentes temas porque seguimos tomando cursos, seguimos educándonos para poder llevar esa información a nuestra comunidad. Por eso es que es tan importante el que nosotros estemos, porque nosotros vamos hasta la puerta de la casa, nosotros tenemos ese acercamiento con las personas. Nosotros podemos llevarle esa información. No nada más es como que la persona fue a un lugar y hasta ahí quedó. Nosotros vamos y las buscamos, nosotros vamos y hablamos con ellos. Y el hecho de que nos vean como ellos mismos y que nosotros también sabemos las necesidades, porque algunas a lo mejor han pasado por todo eso, los entendemos, ¿verdad? No los juzgamos, sino los entendemos. Nos gustaría que nos ayudaran, que se nos reconociera y que quienes tienen la oportunidad de hacerlo, lo hagan. Gracias.
Thank you so much for seeing us, for seeing the work that we do. I belong to an organization. We are nothing but health promoters. And when we go out to the community, we do take our credentials or our ID badges. So within the community, it's easy to spot us. But the work that we do, unfortunately, local authorities don't recognize us. We don't have as many benefits. The organization that I work with, we work as independent contractors per se. So what we would like is that our work had more benefits. That's something that we would like, that local officials would see in us, that they would see us as employees, that we had access to other benefits or additional benefits. That's what we would like to accomplish. And that's one of the reasons why I am here, so that you start getting to know the type of work that we do, and that just like the work that we did in Planada, we have experience in many other areas. That is also something that we do as health promoters. We can talk about different topics because we continue taking courses, we continue educating ourselves so that we can continue taking out the information to the community. This is why it is so important that we are around, because we go and we knock all the way to their door. We have that firsthand experience with the community. We can take that information out to them. So this isn't just like the person went to a location and everything ended there. We go and we seek them out. We go and we speak to them. And the fact that they see us as one of them, and that we are also in tune to their needs, because some of us maybe have gone through the same experiences. We empathize, we understand them, we don't judge them. So we would like for us to be able to be heard, to be recognized, and that those who have the opportunity to do so, do so. Thank you.
Thank you. I think it's lunchtime, but I think we might have time for one more question. We have 90 minutes for lunch and posters, and this is such an engaging panel, and I wonder if you could indulge us with, if there are one or two other questions that people had in the audience, I'd like to make room for them.
Seems like there's a question here.
Hi, good afternoon. I'm Nancy Pope Angulo. I am a nurse, actually, a nurse manager here for pediatric neurology. One of the questions I was thinking of as you were speaking of this gentleman, Santos, and being afraid to speak up, even in the healthcare, we struggle with identifying or even how to approach the subject. Because it's very sensitive to discuss immigration status. But if there's a chance that we have an inkling or a concern, how would we reach out to a promotora to get the kind of assistance? And is there a pathway or collaboration with you with healthcare? I can see that, like, as if it's not, it should be a next step in terms of like working with social services, so that there is that resource and there's that pathway for us to be able to have people assist even in appointments. And is there recompensation for that? So there's a lot of questions, I'm sorry, but my mind's kind of going a lot because this is such an important work, and gracias por todo lo que han hecho.
Como yo lo mencionaba, hay demasiadas cosas que nosotros como promotoras hacemos. UC Davis, por ejemplo, ellos tienen un grupo que están haciendo apenas. Ellos estuvieron dándoles entrenamiento porque quieren que ese grupo de promotoras, por ejemplo, estén basado en el apoyo y las necesidades de las personas con cáncer, quienes hayan sufrido cáncer. Entonces, por ejemplo, ellas están educadas tal cual, ellas van hasta las casas de las personas, tanto los familiares como los pacientes que han sufrido el cáncer, y es el apoyo emocional que una promotora, por ejemplo, puede darle. Es un ejemplo, ¿verdad? Nosotras, como yo lo comentaba al principio, podemos o tenemos la capacidad de hacer eso. A nosotros nos gustaría trabajar con cada uno de ustedes y sobre todo en el tema de la salud. Así que estamos listas para hacerlo. Nosotros estamos buscando esa oportunidad. Si usted tiene la oportunidad, nosotros estamos aquí para hacerlo. Cuando pasó lo del COVID, fue una época muy importante para nosotros. ¿Por qué? Porque nosotros invitábamos a las personas que vinieran a vacunarse. Nosotros hablábamos, claro, no es fácil, porque mucha gente no creía en esto, encontramos todo tipo de personas, pero nosotros sabíamos que nuestro trabajo, la recompensa era ver en esas clínicas, por ejemplo, de salud, tanta gente que acudía a ello, ¿verdad? Y los beneficiados que estaban de todo. Nosotros estuvimos haciendo las clínicas de salud, donde ofrecíamos las vacunas gratis, nosotros educábamos a las personas y estuvimos siempre. Nosotros estamos para trabajar con ustedes, y si ustedes tienen un trabajo para nosotros, nosotros estamos ahí y podemos tomarlo y podemos educarnos. Gracias.
As I had mentioned previously, there are many things that we as promotoras do. UC Davis, for example, they have a group that they are currently forming. They have been going out and doing training with them because they want that specific group of health promoters to be based in the support to those community members who have gone through cancer. So, for example, they are educated in such topics, and they go out to the community members' homes, the family members' homes who have gone through or have experienced cancer, and that's some of the emotional support that a promotora or a health worker could, for example, give. So that's one example. We, as I had mentioned at the beginning, we have the capacity to be able to do this type of work. We would love to be able to work with each and every one of you, especially on health topics. So we are ready to do it. We are looking for those opportunities. If you have the opportunities, we are here to do so. When COVID occurred, it was a situation that was very important to us because we would go out and we would invite people to come in and get vaccinated. And of course, it was not easy because many people had their doubts. They didn't believe. We found all sorts of people, but we knew that our work, the compensation we were receiving was seeing those health clinics filled with so many people attending and how benefited they were at the end of it all, through it all. So we were holding clinics where we were inviting people to come out and get vaccinated and giving them information. So we are ready to work with you. And if you do have work for us, we are ready. We are here. We can take on the work and we can get educated on the topics. Thank you.
I want to, sure, yeah.
I wanted to answer just really quickly. I'm really glad someone asked that because I was like, should I say something about what can folks do? I think, and I'm not that educated on like what, as a nurse or doctors, how far you can talk to folks about laws or rights. But I think even seeing a patient and being like, do you know about paid sick leave, regardless of your immigration status? This visit today, you should be able to get paid for it. That simple is so much help because our community, especially like our immigrant community, really takes what doctors and nurses say, like they really see y'all as professionals. You're professionals, you're really important to them. So just hearing that is more than enough for them to, and being like, you should look up a local organization. I'm sure there's an organization that can help you as your employer to have these 3 hours paid. It's a lot of work. I wish I could say that there's a lot of folks in the community who come in and saying, my doctor, my nurse encouraged me to come. We actually have the opposite of folks who are like, because they go to their company's doctors, right? Like the doctor said I'm not okay, So I just wanted to say, even like a small 2-minute, like, hey, there's paid sick leave. I hope you get, regardless of immigration status, I hope this visit, you're getting it covered by your employer. That in itself is a lot of support, just hearing it from someone else that's not already part of an organization like ours. That's, we're always just fighting the boss. But hearing someone else come from a different professional setting, it's a lot of help. But again, it really goes back to building community. And in San Francisco, we are so lucky, so blessed to be part of a fruitful movement ecosystem of people who care for each other. And, it's not the same in different places. But I do think just like that 1 or 2 minute of like, know your rights around paid sick leave, or having something in your room that has a paid sick leave ordinance in different languages, I think that will go a long way in encouraging, motivating working class immigrants who are excluded to fight and organize in their workplace.
I just want to close by saying I think that this is a real call for action to our health system to do more, and especially our academic health system, because we mostly take care of insured patients, and we don't. We have a lot of people though who may be suffering some of these issues and don't get recognized. I think this is a place where our community health centers may be already doing a very good job with some of these issues in some settings. And we have a lot to learn here at UCSF, I think, about how to do this work better. And so we can start some of this work right here in our own practices and take this knowledge that we're receiving and put it into action. I think that this afternoon we're going to be hearing a little bit more about the Clinical and Translational Science Institute and the resources that we try to provide to support community-facing research infrastructure. And I think there will be a very interesting workshop, so I hope most of you will stay, where we'll be able to talk through in small groups various cases of some of which touch on these issues. And I hope you'll stay for the duration. And I know, Meredith, you have one last.
Just really quickly, I wanted to pass the mic to Reina, if you think she has something to say really.
Yeah.
Thank you so much. It's so hard for me not to be community as well. But just a few things I want to mention from our perspective as interpreters. Oftentimes, I would say if there's anything that you could do as medical professionals, fight back for time with your patients. Because sometimes appointments are so quick, and we've got to understand that many times when it comes to heat stress, when it comes to valley fever, people don't know what they're experiencing. People almost want to believe that it's fatigue, that it's, the long work hours, that it's because they've been out in the sun all day and their body's just stressed. But I've seen many diagnoses, like many patients have to come in 2, 3, 4 times before it's even discovered that they had valley fever. And how much worse is it when it's too late and a person passes away because of heat stress? And I've been there. I've seen it happen. And all because of that lack of time of just stopping the whole process and saying, hey, let me tend to my patient. Let me take my time and listen, because they don't know what they're experiencing, and I'm supposed to find this out. And I have less information, but I need that time to find it out. The other thing I do want to mention is that oftentimes we're still finding that many providers are using their staff, who oftentimes feel nervous, they're new, they're already overwhelmed. And let's be honest, that's not what they studied for. That interpretation wasn't their calling, their forte. It wasn't it's not what enthusiasms them at the end of the day. So why are we putting our staff into positions that they did not fight for? If you studied to be a doctor, you should not be an interpreter. If you have to, and you can, and the need is there, that's great. But if you can use professionals so that everyone can do their job and do it well and enjoy their work life, I think that that's already a win-win for everyone.
Thank you so much. Such important messages. We still have an hour and 15 minutes for lunch and for posters, where you'll get to see some of the individual work that a lot of people here in the room have been doing to address these issues. And we look forward to hearing your feedback. If you're only spending the morning with us, please take time to fill out the evaluation with the QR code on the back of the program, and otherwise wait till the end of the day to do that. And I think if you do, you'll be very glad you did stay, because I think the afternoon will be very exciting. Thank you.